to order. Unfortunately, Chairman Von Bergen had a conflict and I am chairing this morning as vice chair.
Sweet.
I know, twice this week, oh my goodness. So, moving on after
Did you bring the
groans.
cupcakes?
They're in the kitchen, yes.
Yeah,
Cupcakes and donuts,
yeah, because she always brings.
because I always bring. Can I have a motion to approve the minutes as presented?
Second.
Ms. Ness, Ms. Wagner, all those in favor say aye. Oh, wait, I didn't do a roll call. Can I have a roll call, Tamara, please?
Hendricks. Ness.
Here.
Shorten.
Here.
Van Hoff.
Present?
Wegner.
Here.
Altoff.
Here.
Von Bergen.
And Eric did call this morning and said he would not be able to attend. So he had a conflict as well.
Pam still needs to sign
I
it.
still need to sign it. So we had a motion on the floor to approve the minutes as presented. All those in favor say aye.
Aye.
All those opposed? Minutes carry. I do not believe that there is any public comment the last time I walked by. Any member comments this morning? I've got just a couple things. Well, one thing. The farming community, the McHenry County community has been hit pretty significantly in the past several days. Chris Dom, who serves on our conservation district and has been the president, lost his son. And Dan Ziller lost his wife Carol. And the wake and the funeral, the wake is today, the funeral is tomorrow. One was a tragic accident, the other was a rare disease that less than 1%. So if you think about it, reach out to the families.
Can we get addresses?
Yes, happy to, I can share that with you.
That'd be perfect.
Moving on to new business. We have several interviews this morning, one for the Housing Authority, two for the Senior Services Grant Commission. I think, Victor, you're here. Can I invite you up to the front, please?
Carrie's out in the hallway too.
Yeah, right. And we left her there, remember, we're not bringing in. So Victor Oswald, can we go around the room and introduce ourselves? You can sit wherever you're comfy.
You may.
Michael, do you want to start and we'll introduce ourselves so Mr. Oswald knows who he's talking to?
Sure. Mike Shorten, District 4, which covers parts of Carrie, parts of Bow Valley, Woodstock.
Kelly Wegner, I'm in District 5.
Gloria Van Hoff, I'm in District 2. They told me to stop saying that was the best district in, so I'm not gonna say that.
Are they all
Yeah.
in agreement?
No, which is why we told her to stop saying it.
Lou Ness.
Good morning.
Pamela Altoff, you and I introduced ourselves to each
Yes.
other earlier this morning. Again, Victor is here to interview for the Housing Authority. There is one opening, there is one candidate, but let's take this opportunity. Victor, tell us a little bit about yourself, and you're a returning member
Yes.
to the Housing Authority, so maybe you can also address some opportunities, some of the challenges that you've seen over the past many years. I believe, when was it, 2017?
Yes, I've
Right, so you've
6 years.
you've
Yes.
served for a long time. So without
Okay.
further ado.
Good morning. And I have to first apologize because I did not receive the forms from the Statement of Economic Interest. So I live in the same complex, which is McHenry County Housing, but unfortunately, I moved and my mail hasn't been forwarded properly. So ergo, I'm here because I had to resign and then reapply again. So I apologize for the inconvenience for everybody, so thank you. I've been on the board for about 6 years now, and I'm a product of McHenry County Housing because I was one of the unfortunate ones that lost my job in '08 and lost my home that I had. And McHenry County Housing was my savior, actually, because they came aboard because I saw this coming, so I applied, and I was on a 2-year waiting list. And as I see the biggest problem that is facing the housing authority right now is affordable housing. I mean, it's getting very critical, and particularly since most of us are seniors in the housing complex, it becomes a real challenge. And I'm going to say I think there should be more funds available to the housing authority so they can do more affordable housing. And at this point, I don't know of any housing that is being built in the future, but I think that's a real issue. And since I live in a senior complex, I get all these, calls telling me what's going on, what's happening, and there's been a rent increase now, and so it's a challenge. Everybody, I mean, it's just the way the times are right now.
And do you know what the waiting list is currently?
About 3.5, 4 years.
Yeah, thank you.
Yeah, and it's unfortunate, and I think there are over 900 people on the waiting list. So it's become a real issue as things are progressing right now compared to the past. When I first applied, I was on a waiting list also, but they contacted me 2 times. So, and I had to turn them down because I had my home and in Del Webb, and it wasn't sold yet. So I was waiting, and then finally it sold. And then I called, and they said, well, we'll let you know when something comes up. And so there you go. So here I am, and I've been on the commission board, and I really enjoy it because it gives me an idea of what the heartbeat of the community is, and that I can share with the seniors. And a lot of them are very scared. That's all I can say about it.
And we appreciate the fact that you're someone who actually utilizes the services and is still willing to give of your time.
And it's great to have that here, because I know there's so many counties around Illinois that it's also a problem, but McHenry County is growing, especially I live in Green Trees, and which is in Huntley, and Huntley is growing so fast right now that there isn't really affordable housing. And I don't know what's going to happen really, down the road. So anything that the McHenry County can supply or give to the community would be greatly appreciated.
We're working on it. Go ahead, Luke.
I serve with Victor. I'm the liaison to the Housing Authority Board. He's an excellent commission member. He's always prepared for meetings. He has great contributions to the conversation.
Thank you.
So I absolutely would support Victor being reappointed to the commission.
I appreciate
it's really important to have a consumer on that commission who understands
Well, that's yes.
complexities.
That's one of the reasons why when I was asked if I would be interested in it 6 years ago, I jumped on it because I know that they needed an advocate for the seniors, and since I live in the senior complex, it's important to me.
I'll also note though too that his top 2 recommendations come from the executive director and the deputy director of the housing authority. I think that kind of speaks to us, but Luke.
I'll to just share a story that Kim shared with us. They had a woman who had 4 children who was working. She's a bus driver. She applied for a Section 8 certificate. She is in a homeless shelter. She makes too much money to qualify for Section 8 because of the 1960 poverty formulas. And Kim and I spent a good deal of time talking about we want people to work, but really what she would need to do is quit her job. She would need to quit her job, apply for a Section 8 voucher, get the voucher, then get a job, she would be okay. And so some of the stuff the Housing Authority is constrained by, and that's nothing we can do. We can't do anything about it, but I think Victor's comments about the changing demographic and how, I don't think we've had an increase in the number of Section 8 vouchers in years. I think it's stayed pretty static.
Yeah. And I have to be honest too, I am a product of the Section 8 housing. So I'm very familiar with what's going on. And
Yeah.
it's a challenge every year, you know, because there's so many forms to fill out and so many interviews that you have, and it's becoming a challenge. Anything that can be eliminated a little bit would be welcomed, you know.
We'll talk a little bit about that. Anybody else have any questions for Mr. Oswald? Well, I think I had a motion. Oh, yeah,
I'd just
please.
like to thank you for wanting to continue
Oh.
to serve after 6 years.
Yeah.
And I know your input is valued.
Well, I appreciate it.
So
Thank you so
Thank you
much.
for
Yeah.
stepping up again.
I'm delighted because it's a great group. And so anything that I can do to help and contribute to, I'm all there.
So I think I've got a motion, I think I've got a second, right? And I'm going right to the deliberation, I'm kind of skipping over. So can I have a roll call for, just please on that motion?
Ness,
Yes.
Shorten,
Yes,
Van Hoff,
Yes?
Wagner,
Yes.
Altough.
Yes. You don't even have to stay and wait. We're gonna make
Thank
a
you.
recommendation. The recommendation will go to the full county board for confirmation,
I
okay?
appreciate it.
Thank you very, very much,
And
Mr.
thank you all
Oswald.
for your service too to McHenry County. It's, need more people.
Thank you.
Thank you.
Thank you.
Let's see.
Next, we
Thank
have Carrie Holtz, who's coming in,
Whoops.
who will be one of the 2 applicants. There are 2 openings on the Senior Services Commission at this point. Both Ms. Holtz and Ms. Hart, who will be the second interview, are currently serving on the Senior Commission, and they are the only 2 applicants who applied for this particular time. So, good morning.
Good morning.
Real quickly again, Michael, can you introduce yourself, please, and we'll just go around the room.
Mike Shorten, District 4.
Kelly Wagner, District 5.
Pamela Altough, District 6.
Ness, District 7.
Gloria Van Hoff, District 2.
So can you kind of introduce yourself? Tell us maybe a little bit about your experiences. You were appointed to the Senior Services Commission to take Suzanne Hoban's position. Family Health Partnership is one of the only not-for-profit groups that doesn't doesn't meet the requirements for senior services grant money. And that's one of the conditions to serve, is that you not be a recipient. So we were delighted when Family Health Partnership decided to send another individual. So maybe you can talk about some of your experiences and your background. I love her because she brings finance to the group, which is just like way important. So Carrie, floor is yours.
Thank you. So I'm Carrie Holtz. I did serve, I came here and interviewed for a position last year to fill Suzanne's last year of her term. So I was able to sit in on everything for one full cycle last year, and that was very interesting. And for 6 years, I was watching her prepare for this, so I was kind of intrigued. Not enough to take over her spot, but you know, it was presented to me, so here I am. So I have been in nonprofit since I was 18 in McHenry County. I worked at United Way when I was 18 and went to college at MCC. Transitioned to Columbia, got my CPA. I worked in public accounting for 8 years until I had my son. And while I was in public accounting, I was auditing school districts, nonprofits. So I've just kind of always been in the nonprofit world. Since then, I've been in part-time positions. Now I have several part-time positions that are basically 1.5 full-time positions. But again, in the nonprofit world, in the finance space. So I've been kind of on both sides. I was on maybe the funder side, kind of looking at the numbers, or looking at the numbers from afar. And now I'm on almost the direct service side, watching Suzanne with the grants and other agencies that I'm with the grants, and then seeing the impact of the dollars brought into the agency. So it's now to be on this side for possibly a seniors position, looking at senior agencies and helping those senior organizations make an impact in the community is kind of interesting to me. To be able to help. Youth and Family Center is another organization that I work for. So working on the youth, seniors, and then people that are uninsured, it kind of fills my heart. I could do accounting for anybody, right? I could count numbers for big corporations, but it always pleases me to see the numbers in the community making a difference, and being involved like on that management side. So that's basically who I am.
Any questions for Carrie?
How has your experience been on the Senior Services Grant Commission?
So interestingly,
She
I was
doesn't
just,
like the chairman either.
Right.
She what?
She doesn't like the chairman even.
I don't blame you.
Right. It's
I got a big boo this morning when I was chair, so.
So yes, just being on it for 1 year, it was nice to see the full cycle, because I was brought in September, so I was
Right.
able to be at a couple of those meetings, watch from the back, and then be a part of the table. It was interesting because I am familiar with some of these agencies, but seeing their seniors-only applications was interesting, and seeing their seniors-only, it just, I was in LGMC, and one of our days was about all the different generations and how we all work together, and really kind of an impact on the amount of older population we have in our community and how much is needed there. So it just opened my eyes even more to that, exposed me to really almost watching those agencies even from when I was 18. What were the needs 30 years ago, and what are the needs now? And there's just so many more people of need that we can kind of keep in their homes, give them, how about, senior care volunteer network? That wasn't as much a thing back then, but now it's a bigger program to really make an impact. So to watch those agencies make an impact and see the dollars at work, the limited dollars that we have to spend, and to make sure that those dollars are going where they need it, it was nice to be on both sides of that. So I appreciated it. Bianca's great with all the communications. I think we meet enough times during the year to kind of be engaged. So that was helpful too. But I think each year or each cycle will help to understand the dynamics more of the impact,
Thank you.
Anyone else? We have one more applicant, and we'll make the decisions, deliberations thereafter. You are welcome to stay to listen to those. But there are 2 applicants and there are 2 openings, and I'm assuming that they'll, yeah, right? They'll do the math. CPA, do the numbers, do the math. So again, yeah, thank you very much. And can you ask Peg to come in when you
I
go
sure
out,
can.
please? Thank you. Anybody look at Peg's application? You should take 2 seconds. Best application I've ever seen from anybody, bar none.
Thank you.
Good morning.
Good morning.
How are you?
I'm just great, thank you.
So Peg, I'm going to have everyone introduce themselves to you so you know who you're speaking to.
All right.
And then we'll ask you to kind of reintroduce yourself to the group.
Certainly.
And then talk a little bit about your background and what you bring to Senior Services Commission. And then maybe even some of your insight into what you've seen over the years, because I believe you were one of the very founding members of the...
Not quite that
Not
long
quite
ago.
that one? Okay. Sorry.
But almost.
But almost. So, Mr. Shorten.
Mike Shorten, District 4.
Kelly Wagner, District 5.
We've met before, thank you.
Pamela Altoff, District 6.
Blue Ness, District 7.
Gloria Van Hoff, District 2.
Nice to meet you.
It's a very nice district.
I'm Peggy Hart. I'm currently a member at large on the commission. I'm born and raised in Woodstock. When I graduated college, I got kind of crazy and decided to move away and enjoy a career, which I did. When I retired, the first thing I did was move back to Woodstock. And my most important goal when I moved back was to contribute to the community. I had a wonderful life here growing up. I'm a 5th generation resident of Woodstock and McHenry County. Wonderful schooling. I was just so proud that I could say I was from Woodstock, so I wanted to give back. And one of the first activities I got involved in was the Senior Services Grant Commission. So I've seen it, I was thinking last night of the first year I was on, I think it was 2015 maybe. The things that I've seen over the period of years I've served is certainly a much wider awareness of seniors and their unique needs. And I love working with seniors because I am one. I can identify with those needs. I've been immobile. I've had to use a walker. I've had to use a wheelchair. I know the problems that those devices can create for a senior, for anyone. So I think there's a greater awareness of the unique needs, certainly a greater awareness on our commission of the individual nonprofits that offer services and the support that they may need. We have been able to help some of those nonprofits become much more effective especially in their operations and management. And the staff we work with has been wonderful at doing that. We've also this past year gotten involved a little bit in the transportation issues for seniors and trying to get that a bit more organized to be helpful for everyone. I think moving forward, oh, I know the other thing I wanted to say. I think there must be a certain level of security knowing that a group like the Commission is looking at each of these nonprofits and what they do. To me, it's almost like a vetting process each year. That should give people who participate in the programs or their families a certain sense of security. It would for me. In terms of the future, perhaps needs, there's just so many more seniors in our county. It's just growing astronomically. And so the needs are increasing. So finding ways that I think that nonprofits can sometimes work together, which they try to do now, but maybe providing more synergy for collaborative efforts would help. Making sure that we're funding the most effective programs. And that's been a big change I've seen in the Commission, is the research-based efficacy that we look at now. It's not just enough for someone to say in their proposal, research-based program, we need the numbers and we need the proof. That's been a big change over the years, one that I'm thankful for coming from the education field. I think too, something else that I've noticed is the they're not youngsters, the children of seniors, young adults and middle adults, and their search for services for their parents. Is there some way we could make that search more efficient for them? I don't know, but that's something I'd like to maybe investigate if possible. And I'm ready for your questions.
Ms. Wagner?
I thank you for that, because I'm definitely the sandwich generation right now.
Yes.
And as much knowledge as I have, sometimes trying to figure out what help we can have for
Yes.
them
Yes.
is still hard. And I completely agree about the need for collaboration with transportation in our county. To me, that's one of a big challenge in our county, so thank you for taking that on.
Anyone else? Comment,
Yeah.
Gloria, please.
Yeah, transportation comes up as an issue in just about every program we discuss here. So I know that's a problem. What do you think the biggest obstacle is for helping seniors to stay in their home? And is that still, are we doing a better job of that
Yes.
today
Yes.
than we were like a couple of decades ago?
Oh, absolutely.
Okay.
Yes, absolutely. I think the biggest issue in transportation in seniors is door-to-door service rather than curb-to-curb.
Okay.
That's what we keep hearing. When I was tied to a walker, that's what I needed. I didn't want to walk to the end of my driveway with that walker to get in my ride, and that would have been a friend giving me a ride at that point. But that's the chief problem. That's the transportation programs in the county that are typically run by the townships right now. That seems to be their issue too. They want to provide that for their resident base. So we're working with the transportation department and the townships, and Pam's been instrumental in organizing those meetings. Trying to get them to talk to each other and work together so we can get a solution.
Thank you.
Something that I've recently been aware of at greater length are navigators in the recovery
Yes.
system. They're over and above
Yes.
all the recovery services, and their job really is to help resident moving out of residential services and linking them into, and that's what they are. They're navigators. They put these overall networks together and then support that network of providers who are providing. It's actually very efficient. It works really, really well. Yeah, that
That
might be
sounds
an
wonderful.
idea that
That's a great idea.
Well, it is, however, just so you understand, we are limited in how those funds can be used
No, I
for the
understand
commission,
that.
right? And that is the part of the challenge, is that they have to be direct. And so we fight that because we have limited funds, So even if we would want to think about that and expand it, we're limited. So there's all kinds of challenges we're running into. And I can't even begin to tell you how wonderful it is to have Peg. So,
Excellent, very,
yeah.
very good.
My heart's in this, I just love it.
I get that.
And I love being on a commission with new people because I feel that I can, as a teacher, I can help them because the learning curve on this commission is really steep. So it's important that we all help.
Anyone else? Well, we're going to deliberate now, and we have 2 openings, and we have 2 applicants. So Carrie, Carrie, you know, from the commission, was here, and she's an accountant, and she figured out that if there were 2 openings and 2 applicants, it was probably. So, do I have any discussion or Ms.
Motion, I move that we appoint Peggy Hart to Senior Services Grant Commission. Second.
We didn't do anything for Carrie, so I'm assuming
okay.
that's
Oh.
both Peggy and Carrie together?
Can I
Okay,
amend my motion to?
okay, and Ms.
Second.
Okay, Ms. Van Hoff seconds.
One is for a citizen at large and one is for a not-for-profit.
Okay, so the motion, I'm clarifying the motion, it would be to appoint Carrie Holtz as the not-for-profit representative and Ms. Hart as the at-large member of the Senior Services Grant Commission. Is that correct? I'm looking at that.
Yes.
You got that? Okay. All those in favor say aye.
Aye.
All those opposed? Welcome back.
Thank you.
Thank you.
I'll do my best.
Thank you for
very
taking your
much.
time.
Thank you. I cannot tell you how great it is to have Peg on that commission.
May I tell Carrie she made it?
Yeah. Still sitting out there.
I'll just keep her waiting, she can guess.
Too funny.
Come vote before the county board.
Yeah.
Yeah, they'll come before, but I would certainly hope
Yeah.
that, yeah.
Yeah, I don't think they'll be.
Thank you. Yeah, I hope not.
One never knows.
Moving on, routine consent agenda. Are there any items on the routine consent agenda anybody wants removed for further discussion?
I have to abstain from 6-2.
Noted. Anything else? Is there a motion then to approve the consent agenda as presented? Mr. Shorten, seconded by Ms. Van Hoff. Can we have a roll call, please?
Ness,
Yes.
Van Hoff,
Yes,
Shorten,
Yes.
Wagner,
Yes.
Holtz.
Yes. And we did note that Ms. Wagner abstained from 6.2, correct? Yes, thank you. All right, budget reviews, the fun time. The first entity on our budget is the Workforce Network. Gentlemen.
Come on down.
Oh, don't give these guys any money.
We're not asking for
They're fantastic.
no, he's just gonna take it, right?
I would go around the room again and introduce, but we've done that and you've been in the audience, so I don't think that we need to do that again, and you're familiar with the county board. So you're on tap, gentlemen. Go ahead.
So we're going to try to keep this short and sweet.
Thanks.
I gave you a longer presentation in the
Yes.
file. This I condensed. Basically, I wanted to make sure you understand where the money's coming from, what our budget is, and what we do. So with that, so our budget comes from the federal side. We work under the Workforce Innovation Opportunity Act. So under that act, we get formula funds that trickle down. They go from the federal side down to the state and then trickles down to us at the local side. So with that, there's different things that go into the formula. It goes off of like unemployment, different characteristics, kind of what we're looking at. Also this year we did get some state funding. So last year we got a little bit of funding from that. This year we got a little bit as well. So it wasn't much, about $43,000. But to work with some more specialized populations. I'll get into that.
Has that, can I ask just in general, has that money been pretty steady? Or has it decreased from the feds? Not from the state, obviously, that's
The
new.
feds has been pretty stable, but it doesn't take into account the cost of living increases. And this is the second year that the state legislature put up $5 million to the state workforce programs.
Yeah, like for example, last year we had 1.8 million. This year we're at 1.843,000. So just a slight increase. I mean, sometimes it can jump up and down. But with that, there's also kind of on the federal side, how they're looking at it, how they're allocating money towards our program.
Thank you. I'm sorry, didn't mean to interrupt. I apologize.
So with the formula funds so we look at program year, which program year runs from July 1st through June 30th. So it's kind of mixes into 2 different budget years on that. So with that, our adult funding and our youth funding, that actually went up slightly, but our dislocated worker funding went down slightly. So with that, that's kind of going off of what our population's seeing. We're seeing the need more with working with individuals who are in need of funding, that is our adult population, than working with our youth as well to help progress them. Then the dislocated population, those are individuals that are being laid off from low growth industries or positions. Then we're helping them either get into a position that's going to be in high growth. And that's really what the workforce is there to do, is kind of help smooth out that workforce, make sure people are going into positions that are going to be around for a long time. So then with the state supplemental funds, again, I mentioned we got $43,000 with that. So kind of how that was broken up, about $17,000 of that is going towards working with individuals who are coming here from like immigrants, migrants, but all authorized to work in the United States. So we saw a slight increase of individuals in that population, so we got a little bit of money that way. A lot of the funding that was directed towards that went to some other areas as well. Cook County saw a good jump with that too.
Oh, sure.
How also this funding is looked at too is they direct some of that to different areas that have lost funding from their formula funds. We did not, so that's why ours is a little lower. And then also, then we gave a pool to work with to make sure we're reaching other populations. So the other side of that and what we're going to use it for is working with reentry individuals. So we did that last year. So we through this grant, we worked with individuals who are coming out of the court systems to help get into employment in high demand jobs. And we did that through internships. And that's been a great thing for us to be able to do, get them current with their jobs and then into a pathway that they can go forward with. So then, a broad understanding of the services. We provide services to both businesses and job seekers with this funding. So I kind of broke down the state funding, but with those formula funds, that's what we're going to be utilizing to make sure people are going through trainings, to make sure they're developing the skills to get into the pathway. That could be through, I mentioned internships, that could be through a training grant, such as going to McHenry County College for a program. That can also be through, we have a different mechanism called on-the-job training, which is kind of like a loose way of saying an apprenticeship, where a company hires them and then we're helping supply funding for them while they're getting acclimated to the job. And that can last a decent amount of time, 4 to 6 months. We all know it takes a while for someone to get into a job and really be accustomed to that position. So that is presentation. Does
Oh my gosh, we love you! I only have one question. How do you reach into that population to utilize the state funds for individuals who have work visas or whatever the certification? How do we market, how do we reach into that population?
So what we're gonna be utilizing that funds for is basically creating an outreach plan. So we're looking at buying some kiosks that we can put throughout the county. A lot of some other areas have been doing this in libraries, where then we can try to reach that population. And a lot of times we will reach that through McHenry County College, through their adult education program. And that's how kind of in the past we've done that, because they'll get individuals like through their ESL program. So that can be then a referral over to us. And that's all part of kind of the workforce system where we're all working together. So when they get someone who may be struggling with that, they can refer them over. The hard part is we have to make sure they're authorized to work in the United States. And
Right.
that can be the difficult part.
Understood.
So there is ways and things we're gonna try to refer them to agencies to help with that, but we're limited on what we can do there.
Yeah, we've seen an increase in, from Eastern Europe, coming in.
I'm certain.
And they have limited English proficiency, so we've been using the language line, but we also wanted to have some technology in the office for translation services. So we're looking at a couple devices that'll do that so that they can type on them and it translates it from their native language to English and that. So, and then one of the other things is many of these individuals come over with elevated degrees from their home country. And it's not recognized here unless it goes through a certification body to compare it. And there's a cost to that, so maybe we'll be able to help with some of that too.
That would be remarkable.
Can I make a quick comment?
Yes, please.
Just, you probably know this, but if you're trying to reach that population, working with the Illinois Migrant Council.
Yeah. Yeah.
Maggie has been a wonderful partner.
Yes, she is.
Yeah.
I know the Woodstock Library is often operates as a portal. They're very, very inviting, and, I think having the pantry, the food supply out front and the clothing supply out front, and, I've been in there, they're so welcoming and engaging to everyone.
That might be a really good place
Yeah.
for one of the kiosks.
Yeah.
It's a great idea.
Huh?
I said that's a great idea.
Oh, I will say, it is, you can sleep in the chair and nobody bothers you. I mean, that's.
But we're not suggesting to
How would
people
you
that they
know
should
that?
People talk to you.
I might go there, that might be the place for me to go.
Are there any other questions?
Yeah, I just wanted to go back to something you said about the equivalency degrees for people who come into the country with, they may be a doctor in India and they come here and they have to go through that equivalency process. And I know it is costly to do that. So would you be able to pay that for them?
Well, it might be one of the support services. They have to go through our application process, and then yes, in some instances we may be able to assist with that.
Okay.
You'd have to create a policy, I'm certain.
Yeah, I'm a little familiar with that, and I know that it can be pricey, but
In time
we have to
consuming.
do it because in a lot of cases it will allow them to get a higher salary.
Right.
Yeah, and at the bare minimum, we know who to connect them with those. The company's up in Milwaukee that does it. So a lot of times, if they go through the adult ed, they'll help direct them to get that process, and we can then, like Jeff said, help
There's
support
one in
that
Chicago
too.
as well.
Yeah. They're a little slower. They have probably a lot more.
I am absolutely certain that that's the case. Yeah.
Thank you.
Well, thank you. Thank you very much. And so there is consensus to move this budget forward to the full county board? Consensus granted. Thank you very much, gentlemen. Appreciate it.
Thank you for all your support.
The next budget presentation is from our Regional Office of Education. Diane is here.
Good morning.
Good morning.
I'll get closer. Well, I wanted to go over what takes up most of the county partnership with the Regional Office of Education. So the county funds 3 employees at the ROE, and that would be our truancy officer, our licensure specialist, and we have an admin specialist too. And that partnership greatly helps the work that we do at the ROE. The other line items are primarily small, and I'll defer to Carrie if there's any questions on those. But the bulk are those 3 salary and benefit employees. So just see if there's any questions about the employees. We did take, at some times we've had a second truancy officer. Because the state increased funding for chronic absenteeism in the office. So I have taken that position back and able to pay for that out of our funds as well. Any questions there?
Any questions? You've done a remarkable job.
Thank
Again, even in the community, people have commented the services and coordination and effort. So
Thank you.
Much appreciated,
I
truly.
appreciate that too, thank
Really.
you. And just to highlight a couple things that we have been working on. So as you know, our Pearson Testing Center has been a success. We've been able to, provide the rental funds back to the county that we agreed to. So that's been going wonderful. Our top 3 areas of testing are GED, all of the teacher and administrative licensing tests that have to be taken. And then we added on Office of the State Fire Marshal, so now they are number 3. So all of our county and probably even some people out of our county taking all the tests through those sequences for fire districts are our top 3. We are also opening a testing center in the county jail, so GEDs can be taken there. Nice. So even though some of our inmates might be short-term, they can at least get on and start to take their government test. It's actually a module, there's no test, but if they are there for a longer term, they can start to complete some of those things, which would look good to a judge and just for themselves as well, of course. Let me see. We just recently hosted at the McHenry County Community College a multi-district reunification training with I Love You Guys. We first partnered here at the county, and then we've done that. I think we had about 400 multi-district employees there to work on that training, and we will be working on more coordination as time continues forward in case of any type of event where students need to be moved to a reunification spot and get trained employees from multi-districts to come and help busing and things like that. So we've been working on that as well in the county. Going forward, we're very proud that we're hosting our first Women's District Leadership Conference up in Lake Delavan in September. We're looking for about 100 people right now. We're at about 70, 80 people right now, so we have a little bit of push to do that. Kane, Lake, DuPage hosted one that I went to, and it was very nice. And it's a great time for our women district leaders to not only network and collaborate, but plan out their year and get some professional development as well. It was a very good conference, so we're looking forward to that. We're looking forward to, in the future, working on a summer institute. So I've talked to our superintendents, and there are some challenges with trying to do a county-wide institute during the school year due to what's written in teacher contracts and what time off the teachers get and where they can be and what they can choose from. Now there's challenges with offering that in the summer as well because, our educators do deserve their free time, and it's not paid time for them as well. So we're working on that, but offering something in the summer for our educators. Of course, throughout the year, we keep expanding our professional development opportunities, which is one of the things in statute that we are charged with completing for our county. And if there's any other questions, I could go on and on with the things that we're doing, but.
It's remarkable. I hear about the testing center and I hear about the collaboration with the superintendents more than anything else that the office is doing. It's remarkable.
Thank you.
So, Ms. Wagner?
Just real quick, so when you first started, I know that prior to that there hadn't been a lot of collaboration with superintendents and it was difficult. Is it getting easier?
It is. I'm glad in one respect that our districts are self-sufficient. I'm very glad about that. There's models throughout the state where the ROE has many, many employees, very smaller in population than McHenry County. We're the 6th largest in the state as far as student population for an ROE. But there's very small ROEs with student population that have 100 and plus employees because they're providing those employees to districts. There are models like that. I am glad that we can be self-sufficient and then just kind of add on. So it's kind of like which way would we rather have it be? I always tend to think on the side that it's best to have as local as possible because then the needs are known and met with that knowledge, that intimate knowledge of the area. So there's that. We were provided this year, we have an intergovernmental agreement with Illinois State Board of Education, and they are funding a curriculum coach to us for again, why is it a year and 0.75 instead of just finishing out the school year? But I don't know about that, but we'll be able to fund the person for the rest of the 2 months so that they can work a 2-year job. And then we'll see if that's refunded by the state or if it's something that the districts would like to, kind of pay for themselves as well. So we have that in the office. She just started last week, so that's wonderful. And she'll be going out to schools to help them, and there's already a need, so they're already coordinating with her. So that started as well.
And that's the kind of coordination I hear about. I mean, that's valuable, so thank you. Anyone else with any questions? Thank you very much.
Thank you, we appreciate the
Pleasure.
partnership.
And again, consensus is granted to send it to the full county board?
Yes.
Okay, great. Moving on, mental health board. We have both the board president, Connie Machini, as well as their executive. So,
And our fiscal operations
oh, and your
manager.
fiscal, I apologize.
Melanie's
We've
your-
got the full continuum. So Leo, I'm assuming you are definitely going to do the presentation and support. Okay,
Yes.
great.
And the presentation itself, I'm going to move through very quickly. I just have a lot of beginning slides as more of a backup, but since this committee and the county board members have not changed, and our board president and I did a presentation back in May,
Right.
I'm going to skip over a lot of the overview about us, but since you're well aware of who we are. But again, the objectives today is to look at our budget, and also we want to thank you again for being part of the solution that we'll talk about in a moment. Our mental health board directors and staff have not changed, except we did get a quality and compliance analyst since we presented in May. That was an open position, so that is in place at this point. And again, you know our history, that we're from the Community Mental Health Act and all the things that govern us. I'm moving through these quickly. Fiscal year 25, we are looking at a $10.8 million client services budget. It's not our overall budget. And again, we'll talk about how we moved over to sales tax. But as far as, the things that we are governed under the community and the statute, is all those things written up there regarding providing an annual plan, and also, we do set the wages and budget, and we present it for informational purposes here to the county board. We talked about how we are one of the largest, not the largest, but one of the oldest for sure, mental health boards across the state of Illinois. You're well aware of our mission, vision, values, and the 3-year plan. Again, and that's really to lead and contract for quality behavioral health and intellectual developmental services in the community for McHenry County residents. Again, I won't go through all our operations. I'm going to skip through these really quickly and move to, actually probably better to move to slide, I'll just move it. We talked about the issue that we had in the past that we brought to the county board regarding our increased costs and demands and services, and that's why we presented the issue that we want to thank the county board for understanding the issue and also for moving to a solution with sales tax. So we believe that right now, it's really hard for us to forecast the sales tax. We've looked at a few different pieces. For the fiscal year 25 budget, you'll see in your packet, we are forecasting a $12.5 million budget. But from our funding applications, I wanted to show you that currently this year, and this is what the staff, and literally, I know, I'll speak for myself, I am exhausted from working weekends, late nights, and trying to get through the 103 applications besides our daily operations, and really reviewing those so that the board can start doing their reviews. And what we had this year was 103 applications. Out of those applications, it was 5.4. It's the largest we've had, $5.4 million in demand over what we are able to budget this year. And we knew that trajectory was going to continue to increase because in the past, we haven't been able to keep up with capacity. And that's only increased over time. So again, we're playing catch up that we're hoping that with the sales tax, we'll be able to get there over time, but we're still not there today.
And I would also opine that much of it also is because people understood that there was more money available. And so they're gonna ask for more because they feel that maybe now is the time. It's not a bad thing. I mean, but that's just kind of a general, if there's more, I want my fair share. And so I think we're gonna see that.
Right.
Well, if I could
Sure.
add to me, the 5.4 is the unmet need that people have now recognized that there might be money in order to meet that unmet need of no increase for 10 years. So the 5.4 is still the target for us to fully fund up and fully staff up the mental health system in the county. That's kind of how I look at that.
And it will increase, as Leo was saying, is, yeah.
Right. And, you know, out of those funding requests, we had 22 new funding programs. Out of those, there were 5 new agencies that applied.
I've never applied before.
That never applied before.
What were those?
There were things like Grief Guide, St. Mary's for a perinatal. The other one was
Rocking the Spectrum.
Yeah, Rocking the Spectrum, which is an IDD component. Trying to think of off the top. McDermott, which is an out-of-county, it's Haymarket, the out-of-county. And then what was the last one?
That's all right.
Yeah, sorry about that.
No, that's,
It's, you know what? It's all in our, it should be all in our heads, but we've been going through these.
You've got
103.
Do you have?
Oh, yes, best communities.
And do you have a policy that you don't fund first year, not new applicants to us, but new entities that have not been in existence or operating for a year?
Yes, we do have a policy in place.
We prefer 2 years.
It's 2 years.
That was a softball question.
That they're operational for 2 years before they apply to us, yes.
Thank you.
So again, the mental health board services we fund, I think we have informed the county board that, you know, it's not that we're funding agencies fully, but we fund their programs. And some of the programs that we do fund at 100% because they wouldn't exist without our funding due to, you know, state coverage that's not there for billable services. So again, it's services that we fund from agencies, not the agencies themselves. Our mental health board budget for most of the agencies is for most of the agencies, our mental health board funding is a small portion of their overall. But there are some agencies that we fund at greater levels that as mental health boards, we're trying to guide them to diversify their funding stream, not to be so reliant on the mental health board. So there are a few agencies that fit that we're continuing to try to guide them regarding diversification.
But those are essential mental health services. I mean, let's be clear.
Right,
Yeah.
I mean, like NAMI is one of those, definitely. They're essential services.
Yeah, they're essential.
Right. So when we look at fiscal year 25 applications, that's always a question of, you know, what's coming up? What are some of those things? We had some youth prevention program dollars that were in the mix. Some other new programming was regarding psychiatry and child and adolescent, along with women's health services, medical assistant treatment and detox services, recovery home. We did get a capital for a recovery home this past fiscal quarter. And again, some of the grief work in the community, which is something that's lacking. So those are some examples of some of the new applications. When we look at the mental health board budget, this is why we're here. As you can see, the overall budget is right at the bottom, and the client services budget with the opioid dollars, we're expecting to be at 12.6.
But the opioid money is a one-time hit, right?
We have the opioid dollars, I'll get clarification from your question, but just to relay, we're so happy that we have partnered with the state's attorney's office in receiving those opioid dollars through 2038. The way the opioid dollars come into us is interesting. We know the distribution from the distributors' funds, we pretty much can forecast.
But the various pharmaceutical companies that come in from the opioid settlement, we have no idea what those funds are. So they do vary. It's supposed to incrementally increase year over year, the amount that we're supposed to be getting.
Until 2038.
Till 2038. Right.
That's, yeah.
Okay, yeah.
There's
So-
multiple settlements, and those paying have negotiated different terms.
Right.
No, I understand.
So sometimes the terms are, okay, we're gonna pay out all at once, and sometimes they're paying it out over time. So we're really not sure, again, they're anticipating that it's gonna increase time over time, but we're not sure about that.
When do you usually get that information, Leo? I mean, for budget?
You know, we just received payments that we weren't even expecting, so I mean.
So there's no like
we expected,
notification?
yeah, we expected like 300,000 this year, we got 800,000, I believe. So the position we've kind of taken is, we see what we got this year and use that for next year.
Okay, that's what I'm asking,
Yeah, so
so
we're not
we all understand how you do that.
And then the board is really cognizant of these dollars, and even though most of us won't be here in 2038, that we've already decided that in the next few years, we want to make out a plan, because we're using these opioid dollars, much like, you know, if you think about it, like the ARPA dollars, that it won't be sustainable because some of these agencies will have to come back into our levy pool. So, you know, we need to really look at a plan of how we're going to be moving these dollars back. And also, we're working with the state's attorney's office right now to get clarification regarding the use of the opioid settlement dollars on capital, because currently, right now, we have it set aside that it's not used for capital, and it would be great for us to be able to do that, because those are one-time hits.
Right.
But at this time, you know, in looking at the abatement services and programs, it wasn't clear, so we didn't want to do anything until we got legal counsel regarding if we're able to use it for capital, because then that is a portion that we do get, you know, for the recovering homes, for example, that we even got a request for this fiscal year. If we could move some of those capital requests into the opioid, it would really help us. But so we're looking at things like that, but also, you know, we know that we need to make a plan for the opioid dollars and moving that back into.
That's great information. Ms. Ness?
Is the opioid money used specifically for substance use disorders?
Yes.
That's what I thought. And there is a recovery home going into Woodstock, right? On Kishwaukee Valley.
Yes.
Yeah, right there at the corner of,
Yes.
yeah, whatever that is.
Yes.
The corner of whatever it is on Kishwaukee Valley.
And where the retreat currently is, there is another apartment building that is being requested to put in. And
Yeah, I
that's
know,
one of the requests
they have the
coming to us
public
for
hearing.
support.
Yeah.
But
Do you have
it's a
any idea
phased
when you're
system.
going to get clarification from the state's attorney's office about the limitation of those funds?
We haven't gotten any information back. Norm is looking into that.
Okay.
Yeah. Any questions on this slide of the budget? And always fund balance always is I know, a question that the county board has. And again, part of our policy is to have, you know, about 5 million in reserves that we need to have. And especially, you know, we're gonna be really looking at this mental health board reserve policy once we know what the sales tax is. Because sales tax, unlike the property tax, is gonna be very variable, we're not sure if we're gonna need more or less of a reserve. So we're gonna evaluate this in the next year or two. But at this point, we feel like a 5-month reserve is still what we need to have. And we'll continue to look at that. When you look at what's left of the fund balance, I just want to point out that $1 million of our fund balance is being used currently right now, which, you know, I've talked about when I first came, that's not sustainable, but at the same time, it has been a good use for us to, until we can get the sales tax up, of using that fund balance. We're also looking at using $1 million of the fund balance in '25. And again, that's always a moving target. We always get more dollars that come in to our fund balance because of unutilized services for the year. And then we're also having discussions with the treasurer about investing the overlap. So from what we understand, and maybe Carrie has more information, maybe Carrie has more information, but from what we had, the timeline is that in November 15th, we should get an estimated payment of the new quarterly taxes. But we're really working with the treasurer because we also heard that possibly we might get in September, the July sales tax. Is that possibly correct?
Yes.
Oh, it is correct. So what we're doing is we want to work with the treasurer. So we're not sure what that amount is. We're estimating it might be close to $1 million. We're hoping it's about $1 million because then what we want to do is overlap those 5 months and do a tiered system of investments on those overlap dollars. So that's where we're at right now in discussions of what we're looking at doing with that. And that's really it. Again, I can't thank this committee. Many of you were part of, the panels, doing town halls with the referendum. So I can't thank you all enough for being part of the solution and really understanding the needs of mental health.
And can you also highlight though too, the kind of better working relationship with members of the county board and then county administrative staff and the mental health board with regard to finances, because it was a huge, I think, conversation last year and that has been addressed and is certainly ongoing, right?
Oh, yeah, absolutely. What Peter and I have developed along with our board is that we are going to be doing an annual presentation in May. I'm going to be coming here quarterly. I don't know if you want me to present or just, I'll sit up here and you can answer any questions, but I'll be coming to this committee quarterly, and that's new versus once a year. We will be quarterly submitting reports as part of your packet. I will try to be in attendance.
To the full board.
To the full board. I will try to be in attendance at the COW during those times. I know I couldn't, there was a conflict with the August meeting, but when those packets are there, I will be in attendance if there's questions on any of those. And our liaison currently, Carolyn Schofield, will continue to give reports back to the county board. So we have put in, and then any other requests, can go through Peter regarding, any other committee needs and so forth.
And it's appreciated. Much of it is not just to keep us informed, and I would tell you, you're going to make a presentation every quarter.
Oh, okay.
Bringing forward where you are and what's happening and what you see, because you're on the front lines.
Right.
We are not.
Right.
And so you're kind of our opportunity to learn what's actually happening out there with the dollars as well as the need. But that's, the county board changes, right?
Right.
You're consistent. We need that information, otherwise we don't have the right information that we need to make decisions. So it's not necessarily that we're,
Oh, no, I understand.
but it's for our purposes so that we are well informed.
And I think that's wonderful because, going through what we've all journeyed through together, I don't think we were aware of the disconnects.
I'm sure of it.
And so I think the closer that everybody is to understanding everything there is to know about the mental health board, I think is wonderful.
We had county board members that the average length of service was significantly longer, so they were familiar and they had all of that information. That's not the case any longer.
Well-
So there's always new people who have less experience and direct contact with the mental health board, so.
And
that's
I actually think it was pretty clear that when I came on the county board 2 years ago, I was shocked at the condition of mental health services in this county. After working here for 23 years, from 1983 to when I was stunned. Yeah, I know.
Times they be changing.
Huh?
Times change.
Well, it's not the times change, it's just that the money was tightened up and not
Times
released
change.
and not.
And we had a lot of providers, major providers in the community that folded. After
Absolutely.
2008 during that recession and the Ronner administration that made a lot of cuts. There were major, like our family services agency that had, psychiatry and child and adolescent services along with adult services. That was a huge program that
It was a huge
folded and
loss
left
to the
such a-
community.
Right,
Huge.
service bureau.
Huge.
I mean, there were a lot of agencies that didn't make it, and that we're still recovering from that. So I agree with you, Lou, that
This feels more robust
yes.
to me than when I first started. So I'm really glad to see, and to see and to hear. And I think I would echo Pam, you cannot assume that county board members know what you're talking about. And not that, because you just they haven't been involved in it at the same level. And so anything that you can do to educate them about what you do and how I think makes a huge difference.
And again, I think we make assumptions, which is why I asked the softball questions, but I don't understand, or I don't believe that everybody understands that there are limitations on how you can use money, that you're not funding entities, you're funding programs and services. So those are the kinds of things that, again, it sounds repetitive, but it may be new to somebody, and so we appreciate the effort. And again, Connie, to your service on the board, thank you very, very much.
Well, I think I just want to say, Lou's been in the process, you've been in the not-for-profit world, and a lot of people don't understand fund balance. They say, why don't they predict correctly? You can't predict that you're going to see 20 clients and they don't come through, and you serve 16, then that money comes back to us in fund balance. So that's a hard concept for a lot of people to
understand, and you need to repeat. It's like education. We all have to be reviewed, right? You come back.
But the adult learner has to hear it 3 times before they hear it.
Any questions? Any additional?
I would just like to say, when I came on the board, I was already aware of what goes on in mental health because of my background. But what I thought you did that was really good, you and Connie both invited all of the new board members to come and sit with you and learn about 7084 and what the mission and objectives were, and just to offer that opportunity to educate us as new board members. So that was really great, and you'll have the opportunity to do that again after November for the new board members of the first of whenever you decide to do that. That was valuable.
Perfect, and thank you, because again, we offered it, many of you, I think everyone around this table took us up on it, so thank you for doing that.
And now the videotape meetings are coming?
Pardon?
The videotape meetings?
Yes, the videotape meetings are, the live streaming is there, so.
Hallelujah. Yeah. Seriously, it holds everybody accountable.
Well, you don't have to leave your homes, so there's no excuse for not being informed.
Right.
Would you be willing to, I'd be really curious about what you're not going to fund in that 5.4 over. Could I call you and?
Well, it's not up to me, it's up to our board. And
when you made your decision.
Our board makes the final decision in October.
Curious.
At the meeting, it's an open meeting.
It's an open meeting, so what happens is in September's meeting, we'll make our initial recommendations.
No, I know that.
The board continues to review, and then in October, the board will make the final decision.
From a needs assessment perspective, and what I'm hearing in the community, I'm curious whether that will match up, like what my constituents are saying and what you're not able to fund I'm just curious, that's all.
And we can give a report out to this committee.
I just want to like, give me a phone call, I don't need.
But it won't be.
No, you're not special.
Watch the meeting. Give us a few months, and because again, after October, we'll be able to give you that information.
That'd be great, thanks.
Thank you. Anything, Ms. Wegman?
So it took me a minute. You stated the policy was to not fund new organizations unless they've been open for 2 years, correct? So if, let's say somebody is starting up, do you direct them to how they may get other funding, maybe give them advice and mentorship on how they can be successful and what's needed, or maybe if it's overlapping, let them know of that too?
Yeah, I mean, we haven't had, I don't think, any agencies that haven't been in operations for that long, but we do give feedback, for example, when we decline, of the reasons why we decline and what they need to do. Also, if there's potential, if somebody is that new of an organization, since we are seeing one that is a little newer of an organization that could possibly value from a merger with another, we are going to be discussing that with them this year, and because again, they have their own board. But when we see things like that we think could be a good match because of the services they provide and the lack of structure and diversified funding that they have, that they could possibly join hands versus doing more duplicative services, we do we do plan on following up with those recommendations as well. Again, all they can do is, that's all we can do at that point.
But it's appreciated.
When a new agency does apply for funding, we do require they meet
With us.
with management team to discuss, what our requirements are and can they meet them? Because we have insurance that's required, we have audit reports that are required, meeting attendances.
Yeah, all
So,
the
I mean,
quality
we-
outcomes, thank you,
Yeah.
yeah. So thank you. We do for any new applicants, we instituted that 2 years ago, that they have to meet with us, because we saw that there were some funding applications that came in that weren't as appropriate. Not saying that we still don't get those, but it really alleviates when new agencies come to us, are they on the right track? Do they know what we can fund under the Community Mental Health Act? And again, even some of our continued agencies may present us with applications that don't fit into the criteria. But as much as possible, especially for those new agencies, we do want to meet with them to also let them know what the requirements are, that if they do get funded, are they able to meet our monthly reporting data, our quarterly outcomes, and all
And there's
of
much
that.
more requirements of reporting for accountability purposes. I would just ask too, as you think about it, if you do have entities that come and you do notice that there's some gaps or some needs, that maybe you also go and talk to that board. Lots of times the communication doesn't get always, and that's why you have inappropriate applications, because a board may say, but go ahead and apply, not understanding that there are criteria. So, and responsibilities and reporting requirements. And when you have two people who are doing things, they can't do that. So I would just say keep that open as well, because I've seen that as well.
That's a good suggestion.
Any other?
We worked with a company or an organization here in Woodstock that we had to get a 501(c) and get everything to get funded, and they're wonderful. And they had to be in 2 years of talking to work for. So, and they are funded now, and they really are a great organization, so.
Yeah, and in that case, they applied for funding 1 year, they didn't get it, we worked with them so that they were ready the next year.
I think we do that looking at Hans. I think we all try and do that as much as we possibly can with regard to grant opportunities and funding opportunities. So thank you very much, really appreciate it. I'm going to get rid of you now. Thank you very much.
Thank you.
Again, consensus to move forward and present this to the full board. Consensus granted. Thank you very much. And next we have the Community Development Grant Program.
Hi, everyone. Good morning.
Good morning.
This is remnants of 2020 right here going on, so my apologies. I'm going to try to go through this and be as loud as I can. So for the record, I'm Hans Mock, Community Development Administrator, and with our Director of Planning Development, Adam Mullen. I'm going to go through our presentation for community development, which will also include the next item on the agenda, the Senior Services Grant Commission. So this is our staff. We have used temps over the last few years, and so it's a 7.0, and you can probably see there's a little bit more than that on there. But this is our team that you work with, at your Senior Services Grant Commission and at the Community Development Housing Grant Commission, Continuum of Care, et cetera. Our budget is listed here, and as you can see, the majority of our funds.
I can't see that.
Let's see if I can read it out. Okay.
We're just teasing. It's in our packet. It's in the packet. I'm just, yeah.
Yeah, it is in the packet, so we plucked that out of there just so it would be something that I could go over the screen. But as you can see, the majority of our funds are allocated toward projects. And so when you see it, it's in what we call the fours. The contractual line item is the majority of where things go. And that's either direct contracts with organizations or subrecipient agreements, depending on the type of award it is. Likewise, our Senior Services Grant Commission, you'll see a significant amount of that is allocated toward the projects that are funded by the commission and approved by the county board. So I want to talk through what some of our grants are. These are annual entitlements in one way or another. And so the Community Development Block Grant Program, as you know, is our signature program, and we've had it since the mid-90s. And so just about 30 years now. And the funds, I know you're asking some of those questions, what levels of funds are coming up for some of the others that we're presenting here today. and it's pretty stagnant. It needs to be increased by Congress, and there's a lot of advocacy around that, but there's a lot of, as you know, the budgets have not been approved on time since I think we started getting this fund. I think it's been about 30 years since the feds have approved their budget on time. But our community development block grant program can pretty much do anything, and so I know you were asking how many applications we get. Last time there was 27, and so it was 3 times the amount we have to give out. For the home program, that's our affordable housing maintenance and development. You can do tenant-based rental assistance, but primarily is a home buyer and housing construction program. Oddly enough, this last time, our only applicant that was approved by the county board was Habitat, so it's for new housing construction for home buyers. Our senior services grant program did increase. The allocation is now $2 million per year.
And we thank all of you very much for approving that. It's a big deal.
Definitely, definitely. And with that program, we received 23 applications, $2.7 million in requests, and there's $2 million in funds. So out of those 23 requests, some did not move past the pre-application phase. And then our last thing is our continuum of care. That's an annual competition. So there's a de minimis amount that we would get every year, so that's why we're calling it an entitlement. But right now the competition is underway. It's a very substantial application process that our team is working on right now with our COC. And then here's some legacy grants that we're going to continue to work with for the next few years. Emergency rental assistance that will be ending in 2026, right around the same time as the county ARPA funds, so that kind of mirrors that. Home ARP goes through 2029. As we know, we have one of our projects, Taylor Place in McHenry, was recipient of part of the Home ARP funds. The other one would be Pearl 2, which is also going to be in McHenry. And then the last is CDBG CV, that ends in about 2 years, and we're about 95% spent. So that's not going to be around too much longer. All right, so we do receive a competitive lead grant on an annual basis, and we just learned that they're considering making this a formula allocation like CDBG and Home are done. That's going to be interesting if it's approved by Congress, because if you've never got a lead grant, to just automatically get money for a lead program is really something that's really hard to dump on like a community to do. But they're trying to come up with a formula, and so we have sort of a proposal of what the formula could look like. Sort of a little bit boring here, but this is sort of something I came up with about, looking at communities that have already done the lead grant as kind of having a little bit of a leg up. But this, if they work it this way instead of a competitive grant, that means it would just come in annually like CDBG and Home. So that would be a bit unusual for that type of a grant. So we'll see what Congress does. And then, so some potential allocations. We're always subject to receive the ESG program. We have not gotten it. We're right under the kind of, for the formula, we're right under it. And so we work through the state to get our ESG funds. Pro housing, CMAP is applying for the second round. We did not get funded in the first round, and that is out right now for competition. We learned that that's pretty highly competitive. Shelter respite that you gave us authorization to seek out is going to be later this year. We think that we'll get that funding eventually, and so that would be homeless planning, that would be around individuals that may be challenged physical health-wise of entering into a shelter, that we develop some kind of intermediate kind of shelter for them. EPA grant, which you've also given us permission to look at, is highly competitive. We're looking at the first wave of awards they gave out and kind of seeing that they're doing very big projects versus a wide variety. So we're going to kind of reel back in and talk to our communities that we're working with on that. And then foundation grants, we're usually not applying for those, but sometimes get involved in the projects that are funded by the foundations. So 2 supplemental requests that we made. The first one, we haven't funded. And where the money comes from would be interest gained on our $16.4 million Treasury ERP2 allocation over the past three and a half years. And we think with the interest, because it's gone up in the last 2 years, year and a half, we think that we'll have about $340,000 to $350,000. And so we would develop a project around using that fund toward some historic preservation activities, but primarily like housing oriented. So that's something that we're looking at doing. want to get you a little more plaques on the wall out there for the Historic Preservation Commission, excuse me. And then, so there's kind of a description of what that is, what that looks like. We had a projected amount of 300,000. We think that's going to be a little higher. Then the second request, and it's interesting that one of your presenters this morning mentioned this, is that we're requesting a housing development fund. And so much like our other Collier counties, we are very interested in seeking out $1 million for this fund. We would pattern it after home without all of the restrictions. And so under the program, we can consider doing loan guarantees and those kinds of things where the fund perpetuate itself, or in some cases, as an developer pays down, you can, equally reduce that amount and grant that back out. So we can make that pretty flexible if it's local funds. And obviously we have a picture of what it looks like, I don't know, Liechtenstein or something. And again, there's a brief description here, and as we talked about this at the Workforce Housing Work Group, we're seeing that other communities have had to kind of ante up something for this. So this is throwing something out there to discuss.
And we've talked about it too. I'm assuming if there's any opportunities for grants at any level, that's going to be the first question that they ask is how much have you allocated? Have you allocated anything? How much have you allocated? So just again, explaining to everybody here, I think that that's extraordinarily important if we're going to try and grab additional dollars from any governmental entity.
Can this $1 million be viewed in the same way DuPage County put their 2.5 million in? I mean, could this be the county's contribution to the continued whatever around workforce housing? I mean, is it? No. Where did it come from again?
Their general fund.
So it could be viewed as the county's contribution.
That's what I'm saying. So you can say,
Exactly.
so when we apply for additional dollars, if we get to that point, you can say that the county has allocated X amount of dollars.
Well, also, if the workforce housing group says, here's a need that we have, kind of like DuPage, that money is there if that working group has an expense that is critical to their work.
I think it would have to be the full board that makes that decision, not
Oh,
us
yeah,
here, but
yeah,
could
but
it?
I'm saying, well, yes, of course.
Come as a recommendation, but yeah.
Okay,
That's what we
thank you.
envision.
I mean,
Exactly
I'm saying
that.
the full board would have to even determine whether it should move forward as a request.
All I'm saying is, in a sense, we have put $1 million into the workforce housing project that we're talking about.
I think it's good to put that up there and to use DuPage as an example.
It is up there.
Because I'm saying that, let me finish, please.
Okay.
Finish.
What I'm saying is that DuPage committed dollars to this.
Exactly.
To show that they were serious about it, and a substantial amount. And I think for us to commit to do the same shows that we're serious about this, because money will be needed to advance that cause.
But the big, I'm going to point to, the big thing is a program plan would be developed to fully accompany the request. We would know, right? Okay, so thank you, okay.
And so one of the things that we're pretty certain is going to happen at next month's PHCS meeting is we would have a representative from CMAP to talk about how they worked with Kane County to develop their housing readiness plan. We were actually next on the list to have started in the summer. One of their key staff had left. So what I've asked them to do is come and explain what is our role in this, what resources do you need from us? And so we're pretty certain Enrique will be at our next meeting. He'll be patched in via Teams and can talk about that. So that would kind of go hand in hand with all of this stuff as well.
That'd be great.
And here's a picture of the Taylor Place, the first opening that we had there. Really cold day. So any other questions for us?
I do have a question.
Sure.
I have always been curious, I know you spoke at my very first public health meeting, why affordable housing was housed in this committee. I really think it's not the right committee for it. I really do believe it belongs in planning and development. It is bricks and sticks. I mean, it's about development. It's not about community service. This is not a community service. This is a development issue. It's about planning, and I'm just saying, I know
I
that.
know, I totally disagree, but we've had this conversation.
Yes.
Yeah, I disagree as well.
Yeah, I don't think, and for the reason you said, Hans, in the very first meeting, these folks don't need mental health services, they need affordable housing. To me, that is not a community service, that is a critical need inside communities. And so I'm just saying that. Thank you very much. The other question is, what the home money, okay, so the home investment, the McHenry County, what do you call it, the
Home Investment Partnership
Yeah.
Program.
Is that pulled out of the HUD entitlement amount? So what's left over then for the CDBG? Like,
Oh, okay, that's a good question. So it's two separate allocations that come at the same time.
but they were one at one time, right?
The group was one, yes.
Yeah, and then
So-
you pulled the home money out.
Yes.
Yeah,
And then they
and so
remerged it.
has our federal allocation for CDBG increased over the years?
No, it's pretty stable, pretty flat.
And how come? Because I think the need has increased.
Yeah, it's, the reason for that is the allocation overall has not really kept up with the number of communities that get added to the program. So every time a county gets to 200,000 people or a city gets to 50,000, they become entitled. They just take another piece of that pie. So even if you've increased it, you're not keeping up with that allocation. Now, home is a little bit different. That's been variable over the years. So the last couple of years, we've done a little bit better with that allocation. It kind of went down a little bit, and now Congress is debating somewhere between 500 million for the program and something like 1.5 million. They're very far apart at the House and the Senate. So that's a huge difference for what we get. You know, it could be like 200,000 overall that we get, or it could be 800,000. So it's just kind of hard to say where that's going to land right now, but we think it's going to be somewhere in the middle of that.
Okay.
Any other questions? Okay,
All right.
excellent.
Thank
So
you.
do we have consensus to move, did you kind of cover senior services too, or is that going to be, you did kind of, sorry, I think so too. So do we have a consensus to move the community development block grant and the senior services budgets forward? Yay?
Yes.
Okay, consensus. Thank you very much, I really appreciate that. And finally, the health department.
10 o'clock? Look at that.
We're doing good. I'm doing good, let's go.
Okay, unlike everybody else's presentation, there is no overhead presentation.
Not everybody had one.
We're keeping it, we've done it the last few years, but
Just, yeah, come and join us.
Still being back.
round out the table.
And Melissa, thank you for joining us yesterday at the transportation
Yeah, it was
hearing.
interesting. I
Much appreciated.
appreciated the opportunity. Okay. Let me make sure I got all my notes. So, essentially what you have, in your packet is a maintenance budget. The exception is, so you will see actual increases, but that is not in the general fund side. That is on the grant side. What came before you earlier today was a $600,000 grant. So that contributes the majority of those changes. So actually in our grants revenue, our total revenue is up over $560,000. Again, most of that is grants. We had some grants go up, we had some grants go down, but that $600,000 for that new respiratory grant is contributing the most part. We also had to make some, we opted to make some adjustments. Our vital records has been set in terms of our revenue at $75,000 for years and years, but we really pull in consistently $100,000, so we made that change this year to $100,000 to reflect what we expect to get. And then our expenses are up $724,000. Again, that includes most of that $600,000 grant. It also includes the personnel changes for the comp study. Our TB salaries, I don't know if you would notice, but I'm going to point it out to you. So we have Department of Health is Department 51, and then we also operate Department 52 was which is the TB program. Some of our salaries last year, it looks like those salaries went up a lot, but they were actually, part of those salaries got placed in the nursing division on the 5110 and TB is 5120. So that's all it is. It was in the wrong bucket, but if you look at the health department as a whole, it was all under there. That's kind of it on sort of our expenses and our revenue, unless anybody has any questions about those specifically. Otherwise, I'll highlight a couple of other.
Go on and highlight.
Okay, I'll go on and highlight it. We can always come back. So we have a couple of personnel requests. We're just, the first for community health. That is our new division. And we're requesting that we go to full-time, so up 0.25. That change would be on WIC and breastfeeding grant, so it's not going to hit the general fund. And then one is in our veterinary public health animal control to help process the increases in registration, complaints, and all the administrative tasks. We did have a vehicle request, but we're working with county administration and the fleet manager to address our car request because we do need some additional, or we feel we need some additional vehicles to meet our deliverables because we have numerous field staff are out and they have to be out every day. So we really.
And how are you meeting that need right now?
Well, we are not fully staffed right now, so that is where we have cars right now, but when we are fully staffed, we will not have sufficient number of cars. And the car issue is important in the sense that, like, if I go to a meeting, I would claim mileage, right? But we have field staff that are going into difficult situations, both in animal control and environmental health, and in our nursing staff who go do home visits. We don't want them taking their personal cars, right? Absolutely. We want a branded car with our logo, et cetera. And we also have GPS and things on those cars, which we don't have on regular cars. So, but finance and county admin, and then the fleet manager will be working on that. Other changes, just kind of looking ahead. Something that is required, that's mandated because we are a certified local health department, is the Community Health Assessment and Improvement Plan. So that is budgeted this year. We've put in $30,000. That does not cover the entire amount of the study, but we work with our community partners who share in that cost. So we have budgeted $30,000. It could go up a little bit or down a little bit depending on the number of partners that participate in that process. And our mobile clinic, it's currently sitting over across the way. We will do some kind of formal ribbon cutting. We're not quite there yet. We still have policies and procedures that we need to get in place, but that is going to increase our outreach efforts. We're going to really start with WIC to try to increase our caseload, but then we'll also be partnering with community based organizations and see what other kinds of services that's so exciting. We can work together on.
That's so exciting.
Then we have something called Metopio. That was one of the things that we're using ARPA funding for. It is a forward-facing data dashboard. We do have one up right now for respiratory disease, but we are going to be expanding that. So you'll see where we are. And so we'll push out more information about that, but that's something that's exciting that we're finally ready to push that out. It takes a lot of upfront preparation to get the data right, to pull it in, to generate those visuals.
Can you give us an idea of how much staff time is put into that upfront before it's just an idea? Because I forgot to ask Hans how much time they do on grant applications. It's huge. You don't have to come. It's huge. And I just, again, sometimes think that we forget how much staff time is devoted to even putting the application out in front of people to get the money back. And then the amount of time on the back end to do all the reporting requirements, right?
Yes, well, and in this case, like with data, imagine all copious amounts of data come into the health department. Our EPIs have to clean that data. They do that through a different program called Tableau. From there, that data, and I'm not the person behind the curtain, has to communicate with Metopio, and they have to cross-check all that to make sure what those visualizations are accurate, right, and complete. And that does take a lot of detailed work behind the scenes. How many hours they spend on that, I honestly, I couldn't tell you, but it is a lot. And then, of course, the other exciting thing that is coming is the remodeling of the Crystal Lake facility. So we will be going out to bid on that very soon. The architects, we're finalizing the timeline, and that should go out to bid, I think, in September, which I want to say is this month, but it's not quite this month. And then we're going to continue our succession planning efforts. And if you haven't checked it out, we have a recruitment video online. It's really great. The clerk even gave us some props for it. So it's very nice. And it's our staff talking about their jobs. Yeah.
Any questions?
No, I do want to say that I teach the mental health first aid course, and I had your staff from animal control in one of the course. Oh, yes, I do remember. And I actually had no idea what they all dealt with. I mean, I had no idea. And so, some of the situations they had questions about, I was like, muzzle. No, I mean, I'm talking for the humans, not the dogs. So,
that's a great. Our staff, I mean, some of the situations that they are dealing with every single solitary day are really extremely difficult, right? Taxing.
Yeah. And thank you for sending them. It was great to have them all in the class.
We appreciate
it.
And
Pam, thank you for going to the class last week. It was
well worth it.
Anytime you can provide support to people who do this hard work, and then give them some ideas about the difference they can make in it. So thank you. I just want to thank you, department.
Which, hear this, because we've talked about it. When you come before us at one of the cows and you're giving us your annual report, you might want to highlight each of the individual divisions at some particular point so that, again, county board members have a much better, daily operation understanding of what goes on. Because to assume we do is, makes us all very bad because it doesn't happen.
A few people to MHLA. Your department is.
Oh, yes. I mean, between the pandemic, and it's not like a one and done, right?
No, you're right.
We acknowledge that those efforts have to continue because the mental health of the staff is critical. Yeah. And, they go into hoarding situations. If you see some of those pictures, I mean, they are just extremely difficult. You are in full PPE, because there might be feces everywhere. It is not an easy gig to do. And they're not the highest paid jobs, right?
Right.
We're asking a lot of people when they are doing this work.
And then they're dealing with people who also need specific assistance in dealing with the situation. So it's not just the situation, it's the individuals engaged.
All of it, yeah.
And animals that may have to stay in your custody for
Yes,
months,
thank you, right.
who have a lot of varying issues as well.
Well, it opened, it was good. I was so glad you were there, and I learned so much that day. And when we talk about the vehicles, when I worked at Turning Point, I remember we had a guy that came in and took all our license plates down and followed us home.
Oh, yeah.
He went to the utilities and got our addresses and showed up at our houses. That was fun.
Not fun.
That was fun.
Ms. Wagner?
Just quick question. So those supplemental asks for the employees, is that their total pay or is there supplemented from?
That's the difference.
The difference between what they're getting paid now and what we want to pay them.
Yeah.
To increase them to
So they're going
full-time.
from a 0.75 FTE to a 1.0.
But what I mean, so their total pay is 32,000?
That's with the benefits included.
No, I see what you're saying. I think that's the,
Yeah,
that's the additional cost.
That's the additional.
Yeah, that's just the
Okay.
addition.
Okay, I was gonna say, if we're paying somebody 32,000 for a full-time salary.
And 22,000 of that is
And inclusive of benefits. So
Got
it's
it.
the total.
22,000
it's
is the
it's
benefit
total.
part.
Yeah, what's gonna hit the
Which would be
budget.
if they took a healthcare.
Who wants to do that job?
Because it says, well, all right, so.
It's the additional, the bottom part is the additional cost. So the increase to the
Current
budget.
classification, 24,000, that's the rate of pay. And then proposed classification at 32,000. So the impact of the budget's 8,000. Is that, well, not including, I'm not looking at
So
it.
Karen, you have that with
I have it right there.
Yeah, so the current classifications.
Yes.
Yep, so, yeah, the current
Right.
classification is what they make proposed.
Yes,
I'm
which
just asking-
right there, that 34 there does not include the benefits. The benefits are down below. So
So the salary will be 32,
That's what I'm asking.
253.
That's what she's asking, yes, it's
Yes.
32,000.
It's
It's
a-
not a
But
good,
the impact, now that you add in health insurance,
Right.
is a total of 32.
So
I think what she was trying,
Yes,
yeah.
what I'm trying
Oh.
to say is we are paying these employees 32,000 a year.
You are
And
correct.
40,000 a year.
Yes.
correct.
Wow.
Administrative specialist.
Yep, and that's based on the grade, they're in. And, we're always looking at that too and evaluating our staff. Are they graded correctly? And HR has been great about that.
You do realize that in the housing workforce report, we looked at low-income wage earners at 30,000.
Right.
That they couldn't afford housing.
Right, this is just above minimum wage.
So it is one of our goals, working on our administrative specialist positions and classifying them in the 3-step, just like we've done with some other positions, is one of our goals. So regrading them, see where they land based on the CPQ, and then having some levels for them so they have something to achieve, so they stay longer.
anything else? I would invite any of you to come to the public health board meetings that are on the third Monday of the month, just to see the deliberations and the level of conversation that are had at that point as well. So it's available, obviously, open meetings.
And you can always stop by, give us a call, all of the above.
We're good.
Okay.
Consensus to move it forward to the full board, consensus is given. There is no old business, there is no presentations beyond what we just heard. There are no reports, not talking about future topics, no executive session. Motion to adjourn from someone, Mr. Shorten, seconded by Ms. Van Hoff. All those in favor?